Sorry to be here again, but I have to substitute my colleague Cristina Noberasco, who had a health problem in the family and she couldn't come today. This is a preliminary work that we realize why, because as you know, in our region we have a long-standing process of integration of complementary medicine in public health. And one of the main important item and goal is integrative oncology. And this is the act of the government of the region that write the guideline of integration of complementary medicine in oncology, giving some item for acupuncture, homeopathy, and also homotoxicology, herbal medicine, and of course diet, nutrition, and physical activity as part of the treatment, the conventional treatment also. At the moment there are a few clinics, 8 clinics in the public hospital of Lucca, Pisa, Grosseto, and Florence that treat oncological patients to ameliorate the quality of the life and to reduce adverse effect of anti-cancer treatment. And this is the priorities item for Tuscany region for our sector. This is our area, which is Tuscany Northwest, and you see the first one is integrative oncology, the other pain control, atopic disease, childbirth, and gender medicine, which means mainly work on menopause. This is the flyer that every patient, oncological patient, receive, in which she or he can read what are complementary medicine, what if they are useful for him, and where the patient can go to receive complementary treatment. Oh, this is the last achievement. This is a memorandum of understanding with the Memorial Sloan Kettering Cancer Center of New York. We have a memorandum of understanding for a collaboration with some of our institution in Tuscany for 2 items, which is research and training and education. This is the part of the agreement. You see there is the hospitals and the complementary medicine center. This is not in translated. It is a competition for research. It's a call for research because Tuscany region put 27 million of euro to support research in healthcare, and 9 of them in oncology, and 1 million of euro for complementary medicine in oncology. Till now, we have 4 projects, and we are waiting for the decision of the Commission how to make the financiation. This is the last achievement. This is, you see, breast cancer, PDTR, which means diagnostic and therapeutic care pathway, guideline practically, on cancer, released by the government of Tuscany. These are the regional guidelines. And in breast cancer, we have in many parts integrative medicine. This is a small chapter that resume the role that can play complementary medicine and integrative oncology in oncology. And you see there is also homeopathy. Our clinic made a few years ago within the setting of the homeopathic clinic of Lucca, the hospital of Lucca, was made to reduce, as I told before, the adverse effect of anti-cancer treatment and to ameliorate the quality of life of the patient. We are officially, since 2015, in the breast unit of our hospital. And for instance, we have a little chapter in this flyer, who is a small book, who is given to all the patients to provide information about the pathway they have to do. This is more or less the diagram of our work. You see, this is the oncology department of Lucca. They send the patient to the clinic of complementary medicine diet in oncology. The patient meet an expert of complementary medicine and an oncologist. And then after the visit, receive the treatment, or it can be also referred back to the oncologist if there is some problem, or we can be sent also to the acupuncture clinic, and then, of course, control visit after the treatment. This is our cases till now. In these 5 years of work, we have seen 436 patients, mean age 55, but there is a difference between male and female. 38% of the patients were previously using homeopathy. Near all the patients are referred by oncologists, but it's possible also to come with a direct access. There is a small percentage of people coming asking for alternative therapy. Last years were very fashion. Cuban scorpion venom, vidatoxoxazole. In this moment, what is artemisinin, the most requested treatment. You see, this is mean age. This is for women between 50 and 60, and men between more than 60 years. This is our kind of cancer we can see. We see breast cancer is about 60% of the patient, colon, lung, and ovaries. This is the main symptoms that we have. We can see the effect of chemotherapy is symptoms like fatigue, as Bago said yesterday or yesterday. Depression for the news of cancer, effect of endocrine therapy, hot flashes, of course, and other. And important still is comorbidities, which is people doesn't want to take other medicine more than the anti-cancer therapy. This is the significance of our intervention. Hot flashes, you see p-value in made before and after the treatment, fatigue, depression, nausea, anxiety, insomnia, mucositis, constipation. We start this project to see, because we had the impression that we can see a good result, make a prevention for radiodermatitis as you want. So we divided some patients in 2 groups, one that sent by the oncologist before radiotherapy, so we can give them a protocol, homeopathic protocol to prevent radiodermatitis, and the other group that is sent after, and so they didn't do anything. So it's not randomized, but it's random. The people is coming, and so we had a treated group and a control group. We put 4 timeline, which is to be started radiotherapy from 1 to 9 section, from 10 to 19 and 2029. We recorded the personal data and clinical data, and the control group, of course, is using the standard care, which is keratoplastic ointments as standard care to promote tissue repair and healthy skin. This is the way to measure the radiodermitis, so-called RTOG scale. And you see grade none is grade 0, then 1, 2, 3, 4, till 5, which is the death of the patient. This is our simple treatment. We gave them radium bromatum before the treatment, then the patient make radiotherapy, and after a while, belladonna, or maybe sometimes apis or cantaris, according to the kind of the lesion. We ask to them to make some alkalinizing, like sodium bicarbonate or something like that, locally, and then calendula and sometimes aloe gel to finish. Radium bromato, you know what is the materia medica. X-ray dermatitis is the main indication. Belladonna, I cannot explain what is belladonna to you, but you know, you can well understand why we use this treatment. This is our patient. There is a 50 patient, one group of 17 with treatment, and the other control 18 patients till now. Then we have with breast cancer, because the focus is on breast cancer, 6 patients with other cancer, and another group of patients who couldn't start before radiotherapy the treatment, but during the radiotherapy the treatment. Breast cancer, as you have seen before, and the age of the patient was 57, and the sex of the patient are female, mainly 92%. The severity of the patient was controlled with this standard measure, which is ERDOC, and the control group is out without autism. And we saw that 16 patients on 17 have practically just one patient has G3 toxicity, instead of the control group with the patient with only 6 patients with G1, which is the less possible grade, 3 with G2, 4 patients with G3, and finally 6 patients with G4. This is, of course, statistically significant. This is the figure that you can see. This is with treatment, just all of them except one G1, and the other are G2, G1, of course, G2, G3, and G4. And for other breast cancer which are not breast cancer, we made the same. And you see 6 patients and 6 G1, no control group in this case. But we use it like a confirmation, of course, of our work. It doesn't mean that it's not only with the breast cancer. And this is the cases of patients who start the homeopathic protocol from the first to 9 section, and the other 3 from 10 to 12 to 19. And you see from 3 grade, when we see the first time the patient decreasing to 1, from 3 decreasing to 2, from 0 is up to 1, and from 1 remain 1. So it's a sort of treatment of what already exists after the first radiotherapy. This is the same figure, the same patient, another graphic. You see homeoprotocol here and then decreasing, the same, just increasing but very low, and decreasing very, very much. We published some result in this paper last year, and thank you for the attention.